You are sitting there right now with a minor scratch on your arm, maybe a headache you're treating with a glass of water and a couple of pills you bought for $5 at the gas station. You don't think twice about it because the magic of modern logistics has completely insulated you from the biological reality of being a human being on a hostile planet. But let me ask you a question that should terrify you down to your genetic code. What happens when that scratch turns red, then purple, and starts streaking black lines up your arm, and the pharmacy down the street has been looted, burned, or simply closed for 3 weeks? That fever isn't just an inconvenience anymore. It is a countdown clock ticking away the remaining hours of your life while you sit on a pile of gold coins or ammunition that can't kill a single bacteria. Most of you have prepared for the gunfight, but statistically the gunfight isn't what puts you in the ground. It's the microscopic enemy you can't see, can't shoot, and can't negotiate with. Today, I am going to show you exactly how to build a pharmaceutical firewall that will keep you breathing when the hospitals are just death traps waiting for the desperate. You can keep scrolling and trust that your immune system is tougher than 3 billion years of bacterial evolution. Or you can spend the next 20 minutes learning exactly what drugs will become more valuable than diamonds when the grid goes dark. If you want to be part of the fraction of 1% who doesn't die of a simple tooth infection, hit subscribe right now. Let's talk about the supply chain fragility that nobody wants to discuss at dinner parties because it ruins the appetite. We live in a just-in-time delivery system where your local pharmacy holds maybe 3 days of inventory and the distribution centers hold maybe 2 weeks. Here is the kicker that the government glosses over in their little pamphlets. Nearly 90% of the raw ingredients for our essential antibiotics and cardiac medications are manufactured overseas, specifically in China and India. If those trade routes are severed by war, by pandemic, or by economic collapse, the pipeline runs dry instantly, not gradually. You need to understand that when the trucks stop, the clock starts, and there is no restart button for the pharmaceutical industry because it relies on complex global chemistry that cannot be replicated in your backyard. While everyone else is raiding the grocery store for toilet paper, the smart money, the survival money, is already securing the chemical compounds that keep the human machine running. The first category we need to secure is the one that changed human history: antibiotics. Before the discovery of penicillin, a blister from a new pair of boots could result in an amputation or a funeral, and that is the world we are returning to the moment the power goes out. You need broad-spectrum antibiotics because in a collapse scenario, you won't have a lab to culture the bacteria and tell you exactly what bug you're fighting. You need the tactical nukes of the bacterial world, the ones that kill everything in the blast radius, and you need to know how to use them without destroying your own kidneys. Amoxicillin is your infantry, the frontline soldier for upper respiratory infections, ear infections, and some dental issues that can incapacitate you with pain. It is generally well tolerated, widely available right now if you know where to look, and it covers a decent range of common pathogens that thrive in dirty, close-quarter survival conditions. Then you have doxycycline, which is your special forces operator because it handles the nasty stuff like typhus, Rocky Mountain spotted fever, and even anthrax if you get unlucky enough to face a biological agent. Doxycycline has a shelf life that defies the expiration date stamped on the bottle, staying potent long after the manufacturer says it's trash, provided you keep it cool and dry. But you cannot stop there. You need ciprofloxacin for when things get visceral, specifically for abdominal infections, severe urinary tract issues, or infectious diarrhea that will dehydrate you to death in 48 hours. Cipro is a heavy hitter, and it comes with side effects that can rupture tendons. But when the choice is a popped tendon or septic shock, you take the limp. Let me be absolutely clear about something the medical establishment hates admitting. Fish antibiotics are often the exact same chemical formulation as human antibiotics, made in the same factories, just labeled for the aquarium trade to bypass prescription laws. I am not telling you to go swallow a tank cleaner, but I am telling you that in a grid-down scenario where there is no doctor, a bottle of fish mox might be the only thing standing between you and a slow, agonizing death from a puncture wound. You need to do your own research on the identification codes stamped on the pills to verify exactly what you have, because ignorance in pharmacology is lethal. Moving on to pain management, because pain is not just a sensation, it is a psychological weapon that destroys your will to survive and clouds your judgment when you need to be sharpest. You need to stockpile acetaminophen and ibuprofen in quantities that seem absurd right now, because they are the only things that will allow you to function through the inevitable injuries of a physical survival lifestyle. Acetaminophen is your fever reducer, and keeping a fever down preserves calories and hydration, two resources you cannot afford to waste shivering in a sleeping bag. Ibuprofen is your anti-inflammatory, essential for when you sprain an ankle running from a threat or throw out your back digging a latrine. But here is the dark truth about pain management in a collapse. Effective, strong painkillers like opioids will become the highest value currency on the black market, worth more than gold or ammunition. If you have leftover prescriptions from a surgery, you do not flush them. You vacuum, seal them, and bury them in the deepest part of your kit, never to be spoken of. The moment people know you have strong painkillers, you become a target for every addict and desperate soul within a 10-mile radius, and they will not ask politely. You treat pain management as a top-secret clearance-level operational detail, and you only use the heavy stuff when the alternative is a scream that gives away your position. Now we have to talk about the chronic conditions, the silent killers that will wipe out a huge percentage of the population within 90 days of the pharmacies closing. If you or a family member depends on insulin, blood pressure medication, or heart regulators, you are living on borrowed time unless you take drastic action immediately. Insulin is the nightmare scenario because it requires refrigeration, and once the grid goes down, your stash has a shelf life measured in weeks, not years. You need to look into evaporative cooling techniques, essentially building a pot-and-pot refrigerator that uses water evaporation to keep the internal temperature down without electricity. But eventually, the insulin runs out, and that is a hard reality you have to mentally prepare for right now while the lights are still on. For type 2 diabetics, the survival strategy is dietary discipline that borders on starvation to manage blood sugar, but for type 1, the outlook is grim without a stockpile that spans years. For blood pressure and heart medications, you need to have the uncomfortable conversation with your doctor about getting a 90-day supply, and then you need to lose a bottle every now and then to build a buffer. While everyone else is playing by the rules of a system that is about to fail, you need to be securing the chemicals that keep your pump running. Let's shift to the unsexy killer that has claimed more lives in history than all the swords and bullets combined: gastrointestinal illness and the resulting dehydration. You need loperamide, commonly known as Imodium, in massive quantities, because dysentery doesn't care how many rifles you have. In a survival situation, water quality will drop, hygiene will degrade, and you will inevitably ingest something that turns your digestive system into a high-pressure fire hose. If you cannot stop the fluid loss, you will die of electrolyte imbalance and organ failure within days, all while fully conscious and miserable. You need to pair your anti-diarrheals with oral rehydration salts, which you can buy in packets or learn to make with salt and sugar, but having the pre-mixed packets is a tactical advantage. The ability to stop the flow and replace the fluids is the difference between a bad week and a shallow grave. Now let's talk about allergies, specifically the anaphylactic kind that can close your throat faster than you can say epinephrine. If you have severe allergies, an EpiPen is a literal life switch, but they expire quickly and are impossible to get without a prescription. You need to know that epinephrine in an autoinjector often remains effective months or even a year past its expiration date, although it may lose some potency. Do not throw away expired EpiPens in a collapse scenario. A slightly less potent shot is infinitely better than choking to death on a bee sting. For the rest of the population, a massive supply of diphenhydramine or Benadryl is non-negotiable for treating allergic reactions, insect bites, and even as a mild sedative for sleep. It is cheap, it is shelf-stable, and it has a dual-use profile that makes it a highly efficient use of space in your medical kit. Storage is where 99% of people fail. They buy the meds and then shove them in a bathroom cabinet, which is the absolute worst place in the house due to humidity and heat fluctuations. You are destroying your investment every time you take a hot shower. The enemies of pharmaceutical stability are heat, light, oxygen, and moisture, and you need to fight a war against all four of them simultaneously. You need to vacuum seal your long-term storage in Mylar bags with desiccants to suck out the moisture and oxygen absorbers to prevent oxidation. Keep this cache in the coolest, most temperature-stable part of your home, which is usually a basement or an interior closet on the ground floor. If you live in a hot climate, you need to bury a cache in a waterproof container below the frost line where the earth maintains a constant cool temperature. Do not overlook the power of topical antiseptics like povidone iodine and antibiotic ointments, because in a world without systemic antibiotics, Preventing the infection is your only safety net. A tube of neosporin is worth its weight in gold when a paper cut can become a gangrenous limb. You also need to understand the concept of the medication cliff, which is the psychological and physical withdrawal that happens when people abruptly stop taking psychiatric meds or painkillers. If you are on SSRIs or benzos, you need a tapering plan printed out on paper, because quitting cold turkey during the most stressful event of your life is a recipe for a psychotic break. Let's talk about the economics of the post-collapse world and how your stockpile fits into the barter economy. You never ever trade a medication in its original bottle with your name and address on it, and you never let the buyer know how much you have. You create unit dose packets. 3 days of antibiotics, 5 pain pills, sealed in small bags that look like they are all you have to spare. This is Operational Security 101. If you look like a walking pharmacy, someone will decide it is easier to take your inventory than to trade for it. You also need to acquire a physical, hardcover drug reference guide, like a nursing drug handbook or a PDR, because the internet will not be there to tell you the dosage for a child versus an adult. Knowledge is weightless, but a book is a durable backup for when your memory fails under stress. The reality is that most modern medicine is designed to treat the symptoms of a comfortable life, high cholesterol, heartburn, anxiety, but survival medicine is about keeping the machine moving. You need to prioritize the drugs that solve acute, life-threatening problems over the ones that manage long-term decline. This is the physics of survival. Entropy is trying to break your body down, and bacteria are trying to consume the energy you have stored in your cells. Pharmaceuticals are the chemical weapons you use to hold the line against nature, which is not a kind mother but a ruthless predator waiting for a moment of weakness. Here is the strategic advantage that most preppers miss. Having the ability to heal someone else makes you valuable to a group, and value is the only thing that protects you from being cast out. If you can cure the warlord's infected tooth, you have bought yourself protection that a rifle alone could never secure. But you have to decide who you help and who you turn away, and that is a moral weight that will crush you if you aren't prepared for it. You cannot save everyone, and if you give away your last course of antibiotics to a stranger, you have effectively signed your own death warrant for the next infection. Now, let's talk about the legalities and the gray zone, because I know some of you are worried about stockpiling prescription meds. I am telling you to work within the system where you can. Ask for extra refills, explain you are traveling, use telemedicine services that are more lenient. But ultimately, you have to decide if following the rules is worth dying for. There are legitimate companies now, survival-focused medical services, that will prescribe you a JACE case or a similar emergency kit with all the heavy hitters I mentioned. It costs money, yes, but think of it as an insurance policy that actually pays out when the world burns, unlike your car insurance. You need to look at your medical prep as a 3-tiered system: the everyday boo-boo kit, the trauma kit for holes that bleed, and the pharmacy kit for things that rot you from the inside. Most people stop at the Band-Aids. The tactical community stops at the tourniquets. You need to be the one who goes all the way to the molecular level. And here is a warning about natural alternatives. While herbal medicine has its place, willow bark tea is not going to stop a raging staph infection that is moving toward your heart. Learn the plants, sure, but do not delude yourself into thinking a dandelion root is a direct substitute for a distinct chemical compound synthesized to destroy cell walls. The clock is ticking on your health every single day, and right now, the system is holding back the tide with a fragile dam of logistics and commerce. When that dam breaks, the biological reality will flood in, and the only thing that will keep you dry is the stockpile you build today. You can sit there and hope that the government will airdrop penicillin to your doorstep, or you can take responsibility for your own biological survival. Open a new tab, look up the shelf life of what you take, look up the fish antibiotic equivalents, and start building your firewall pill by pill. Map out the pharmacies in your area, not to loot them, because they will be death zones, but to know where the unprepared masses will congregate so you can stay the hell away. Your logistics must be internal, secured, and redundant, because hope is not a strategy and luck is not a supply chain. Run the numbers on your budget and ask yourself if that new optic for your rifle is really more important than a course of doxycycline that could save your life from a tick bite. The rifle protects you from the two-legged predators, the meds protect you from the billions of invisible ones. This isn't about paranoia, It is about the cold, hard math of survival in an entropy-rich environment. 99% of the population is one infection away from the history books, but you have the chance to be the outlier, the anomaly, the survivor who refuses to fade out because of a microbe. Class dismissed.